Good afternoon, viewers. I, Ms. Tinu Alexander, lecturer from Department of Pediatrics, Bharati Vidyapit, deemed to be University, College of Nursing, Navi Mumbai. Today we have Dr. Kapil Sir, consultant pediatric. He has an experience of 20 years, more than 20 years actually. Good afternoon, sir.
Good
We are
afternoon.
happy to have you.
Thank you.
Today we are going to talk about the topic healthy life, healthy lungs. So let's start, sir.
Yeah, please.
So our first question is, what does the phrase healthy lungs and healthy life mean to you, sir? And why do you think that lung health is important for the overall well-being?
Okay. So thank you very much for giving me this opportunity to speak about the lung health and in general the effect of lung health on your healthy life. So healthy lung and healthy life. This phrase means first of all we'll need to know the functions of lung. Then we'll get to know the impact of healthy lung on your life. So basically if we'll talk about lung, the main function of the lung is to absorb oxygen from the environment, to supply it in your body and remove the byproduct in the form of carbon dioxide
Yes.
and other toxic gases or the metabolites from the breath. So if we'll talk about every cell that in our body which is functioning, the basic fuel for functioning those cells is oxygen. And the function of the lung is to get that oxygen from the environment. If we'll talk in the sense of importance, then if we'll talk about food, then we can sustain without food for days together, for
Yes.
weeks together.
Yes.
We can sustain without water for weeks together. But if we'll talk about air, if we'll talk about oxygen, we cannot survive even for a couple of minutes. So the importance of lung, we can think from that it is doing such a tremendous work by absorbing oxygen and supplying it to the entire body. So our survival is based on the lung itself. If there is no lung, there is no life.
Yes.
So the importance, the healthy lung we need to have. So first for that we need to know what is healthy lung. So as I have told you, the function of the lung is to breathe.
Yes.
So we need to inhale, exhale air continuously. So if at all we are functioning, if our lungs are healthy, then this function of the lung should go without any effort. One should not feel conscious while breathing air.
Yes.
So there should not be any difficulty or discomfort while breathing or inhaling air inside. So basically when your lungs are healthy, then only you can perform your daily activities. So those daily activities, it starts from your daily routine to the recreational activities, to the physical activities, to your sleep. So if your lungs are not healthy, then you will not be able to breathe comfortably. So your daily activities are affected. And for your healthy life, you need to have recreational activities, which will be very difficult if at all your breathing is not regular, if there is a problem in your breathing. And at the same time, if your not breathing is not proper, nor neither can you work efficiently, nor can you sleep properly. So overall, if your lungs are not healthy, then it has a direct and first line impact on your healthy life. So the healthier lung will give you healthier life and a longer life.
Yes, sir. So now, so what do you think? At what age should we start caring about our lungs?
Okay. So generally there are many misconceptions related to the particular age group to take care of your lung. So if you'll ask me, the care of lung, it starts in womb itself.
Yes.
So only the role of caretaker and the caretaker keeps on changing. So for that matter, when your lungs are developing, at that time a mother should take care. Mother should take care of her nutrition, should take care of her vaccination, should take care of her overall health and infection, so that the lungs will be developed in a good, proper functioning way. So your lung care start when the baby is in womb. So it starts from there with maternal care, and once the baby is born, then it start the role. Only the format of the care will change. So at after birth, what is important to maintain your good lung health? You should have adequate breastfeeding. I mean, the baby should be breastfed exclusively for initial 6 months.
Yes.
At the same time, the plastics nowadays we can see the formula fed, the water bottle feeding, they are all at their use is at rise. So these all are allergens, and these allergens can cause lung issues. They are those kids who are formula fed, those who are fed with the plastic bottles and all. They always have a higher chances of allergies. So that care should be taken care by mother. At the same time, government of India has introduced so many vaccinations. There are so many vaccines which are targeted towards the lung health. I mean, if you look at the mortality data, under 5 mortality rate is very high in case of respiratory
Yes.
illness in India.
Yes.
So your lung care should be, only the format will change here. Now as you're taken care of nutrition, you have avoided pollutants like plastics and all. At the same time, a good vaccination, appropriate vaccination as per age in pediatric age group is very necessary to prevent these lung illnesses.
Okay.
So in young age, in womb, then as child go to the school, at that time you should avoid junk foods, the plastic, preservative wala food. Then as they grow old in teenagers, what is that? In their teenage, you should encourage physical activities. Actually, physical activities should begin with the school age itself.
Yes.
But during teenage, you should focus more on their habits. You should avoid the influence of smoking. You should avoid air pollution, direct or indirect smoking. So at all age group, these healthy habits, these lungs should be taken care.
Yes, sir. So, what do you feel? What are the common habits that we have to start maintain to prevent from or damage from the lungs, and like what are the measures that we can take to keep the inner indoor air quality better?
Okay. So if you look at the first part of your question, the habits, the important habits just now that I mentioned, as the person grows in age, the passive smoking, active smoking, these are the things that you should avoid.
Yes.
You should avoid the air pollution in general. You should help in maintaining greenery around. You should do have a definitely fixed hours of exercise and outdoor activities on routine daily basis. There should be good sunlight exposure. There should be good nutrition, good hydration, and age appropriate vaccination. As I already mentioned, it should be the part of your routine life. The time to time vaccination related to the seasonal illnesses like influenza, now we have seen the COVID vaccines and
Yes.
all, they should be taken at appropriate age. And that vaccination again is there for elderly age group as well. So the susceptible population should be vaccinated at the right time, and those the air quality and all those things should be mentioned. If we talk about the indoor air quality, then at indoor the things, see, maximum time we spend is in our houses.
Yes.
Once we
Yes.
come back from the work and all, so the thing that you should maintain at home is that good ventilation. There should be cross ventilation. There should be good greenery around. There should not, the house should not be located in an industrial area. You should avoid mold on the on the walls. You should wash your curtains regularly, and those kind of routine, and you should curtain the bed sheets and all should be cleaned periodically. So these kind of general cleanliness, good ventilation, and if you have any member who is allergic, in that case you should avoid incense sticks, the strong smoke of
Yes.
incense sticks. You should avoid burning of the kapurs and all, and overcrowding should be avoided. So these few things are necessary to maintain good air quality in the house.
Yes, sir. So, what are all the means in which we can maintain a good, healthy lungs?
Okay. So maintaining good lung health is a multifactorial thing. So it starts from your nutrition. It again, how do you maintain your general overall well-being, and how do you prevent things. So if we'll talk about nutrition and hydration, the good nutrition, which is rich in fiber, rich in antioxidants, that helps in preventing illnesses, from acquiring illnesses from the environment. And the good hydration will help in clearing that illnesses or the bacteria or the pollutants which we inhale while breathing. So good hydration will help in remove that particles or the pollutants from your lung easily.
Yes.
So good nutrition and good hydration is definitely very necessary for all the age groups, and more so in pediatric age group, because if you will see, those who are underweight or those who are undernourished have more chances of developing lung infection. So maintaining good nutrition at all ages, healthy nutrition in elder ages is necessary at first stage. Second thing, prevention is like about vaccination, age appropriate vaccination. I already told you they are necessary in preventing lung health, preventing your lung infections and lung damage. And the last part related to the,
Like vaccines, can you specify like what kind of vaccines are very important for the children?
see, there are in your national immunization schedule, there are many vaccines targeted towards the pneumococcal diseases. They are very necessary. Your seasonal influenza vaccines are necessary. Your COVID-19 vaccine is necessary. So those kind of things, all vaccines which are available should be periodically taken and updated in your vaccination card.
Okay, sir. So, what are the early signs, like symptoms, that you would tell our viewers that they should take care of?
So, as I already mentioned, the good healthy lung is one where you are not conscious about your breathing.
Yes.
So, naturally, the first thing is that there should not be any difficulty in breathing. Second thing is that there should not be any easy fatigability.
Okay.
Third thing is that you should be able to sleep peacefully. These are the basic things that you should look after.
Okay.
And apart from that, symptoms like persistent cough, then exercise intolerance, sleep time disturbances because of cough,
Okay.
then inadequate weight gain. In such situations, and chest pain, then easy fatigability, those kind of things should be taken, like considered as a warning sign. Yeah, one more important thing nowadays, that frequent episodes of respiratory infections
Yeah.
or allergies.
Yes.
So these kind of things you should be aware about the.
Specifically, any time limit for the children to sleep? Like they should
Okay.
have that much?
See, the sleep time is very important. So nowadays, all your even government of India has taken care of these suggestions. As age group advances, the sleep pattern changes. But more or less for school-going children, the sleep should be not less than 9 hours, 8 to 9 hours. Minimum that much amount of sound sleep is necessary for good health. At the same time, there should be enough time to for outdoor activities. Their exercise should be promoted. Their adequate sunlight exposure should be promoted, along with your all healthy diet habits and all that I have already mentioned.
Okay. What are the early diagnoses that we can take care of, and what, like we have heard about the lung function test. So can you enlighten us regarding that also?
You mean to those respiratory conditions
Yes,
like
yes.
asthma and
No,
TB
like
and those
what are
things?
the early diagnosis tests that we have to do? The lung test that we have
Okay.
to do.
So see, lung tests are like your lung function test or pulmonary function tests are recommended by your pediatrician or your physician whenever there are frequent episodes of these recurrent illnesses, respiratory tract illnesses or asthma kind of things are there. Then these are recommended by your physician or the pediatrician. And those lung functions like spirometry, your oscillometry, they help in determining the area of lung which is affected, and that is necessary to pinpoint your diagnosis, at the same time to give you the appropriate management for it, because many diseases like asthma, tuberculosis, COPD, your lung cancer, those things are very much common in the society. So if we have a proper checkup and if we undergo those tests, then we can figure out the disease easily. At the same time, the measures can be taken to manage it effectively, and at the same time, they are treatable conditions. So your quality of life is maintained very well if you have taken care of all those things.
Okay, sir. Uh, in your opinion, sir, what is the biggest challenge in maintaining the lung healthy life?
Okay. So there are challenges from the point of view is your it begins with the person, like where are you supposed to take those measures. So biggest challenge in current date is the air pollution that we are facing nowadays. So this rampant air pollution, industrial air pollution, this loss of your green areas. They like those green areas and open spaces are your lung areas for the society. So they are the lung for your environment. So cutting rampantly of these green your green shades and all, that is the biggest challenge. At the same time, in the increase construction, your residential complexes near industrial area, and at the same time increase vehicles. These are the biggest challenges, along with smoking, yes, as a personal habit.
So, as you have shared so much of information, sir, what is the message that you would like to give our parents and children for maintaining the good health?
Okay, so the most important thing is that your nutrition should be taken care, as I have already mentioned, at the particular age group where what all care can be taken.
Yes.
So good nutrition, good hydration, then very good outdoor activities. It should be encouraged at the school level, community level, and there should be policies in your by the government and it should be enforced.
Okay.
So encouraging those outdoor activities, school exercise, regular vaccination, and prevention of those pollution. So these kind of things, and they can be influenced by your media publicity also. So nowadays we are seeing air quality index is highlighted everywhere.
Yes.
So they should be regularly and sincerely followed up. At the same time, at personal level, whatever things we have discussed should be taken care.
Thank you, sir, for your valuable information. I hope our viewers also have enlightened with the information. Thank you so much,
Thank
sir.
you very much. Thank you very much for giving me this opportunity.